Hello and welcome to another episode of Walking with Walfinch. I'm very happy to announce we have Debbie Harris, the founder of Autumna, with us today. Hi Debbie, how are you?
I'm wet,
Yeah.
but other than that, I'm absolutely fine.
Nice rainy walk in Hampton Heath,
Absolutely.
just what the doctor recommended.
Getting my steps in, Rick, getting my steps in.
Yeah. So where are you based, Debbie?
Tunbridge Wells.
Okay.
Yeah.
So yeah, nice connectivity into London.
Yeah, that's easy to get into London when so long as the trains are running and all the rest of it. Yeah.
We're all good. And
Yeah.
so Debbie, I'm going to open this umbrella.
As
There
it
we go.
starts to
As
rain.
it starts
Yeah.
to rain. Perfect timing. So tell me, where did it all begin? What is Autumna and where did it start?
Okay, so I think I started in the place where a lot of people start for social care. I needed to find a care home for an aunt, and I was the person who was delegated to go and find the care home. And I was in a typical space that so many families still find themselves in today. I'd never been in a care home. I'd never heard of the CQC or the regulator at the time. I didn't know what I was looking for. I didn't know what good looked like. I didn't know anything.
Yeah.
And I had to find somewhere in about 2 weeks for her. On top of all of that, this was for Auntie Margaret. And on top of all of that, I'd only met Auntie Margaret about 3 times in my life. She was self-funding, and I was about to start spending quite a lot of her money.
Yeah.
And I
It's
thought,
quite a scary situation to be in.
it
actually, isn't
really was. And the family were relying on me to make the best choice.
Yeah.
And I remember sitting at my kitchen table with the yellow pages. And at the time, there were 18 care homes within, I think it was 5 miles of Tunbridge Wells.
18 care homes.
There's now 43.
Oh!
Yeah. How do you choose?
I mean, well, at
How
least
do you
there's choice.
choose? Well,
There's too much choice.
Yeah, exactly. And so I just thought, I can't be the only person who's experiencing this. Now, this is at the time, I was looking at the yellow pages, so this is before anybody had a computer at home.
Yeah.
I had never sent an email at this point and in my life. I had one of those Amstrad phones that had all the telephone numbers all in it. Alan Sugar, I thought, that was brilliant. But, I had no idea how to do all of this. But I just thought, so if this helps one family, then it's going to be worthwhile. And yeah, that's basically where it started.
Wow. And what year was this in?
2009.
Yeah,
2009. Yeah.
Gosh, wow.
Yeah, and then so we set up a little company, which I think the thing that we've done is because I've always been plugged into the families, the consumer side. I've always looked at it at what does the family need to make that informed decision. And I set up this little website and just put on it everything I wished I'd known when I was making a decision.
Which is great, actually.
Well, it's a good starting point, isn't it?
You're talking, that is your consumer, it is you in that buying position.
Exactly.
Yeah.
And I realised really quite quickly that we were really missing something because I was listing at the time, care homes had a 3-star rating.
Yeah.
I can't remember what the regulator was even called then. And so we were listing 3-star rated care homes. And I thought, do you know what, but there's still 3,000 of them.
Yeah.
How do I then distinguish between those? So I thought, well, there's one group of people that know these care homes inside out, and it's the people who visit.
Yeah.
So I set up a review system.
Yeah, TripAdvisor for care homes, basically. Yeah.
And carehome.co.uk bought my company for the reviews.
Wow.
And that's where their reviews came from. But it was very much consumer driven.
Yeah.
And so they bought my company, that's fine, that was years ago. And then I carried on working with families, supporting them, and we realised that doing it on a almost a face-to-face basis just wasn't scalable.
Yeah.
And the information available online wasn't enough. And we needed to do something else. We needed to move to the next step. And so we built Autumna based on quite literally thousands of case studies of families looking for care. And that's where Autumna came from. And it launched, I think it was 6 months before COVID hit. And so I know, yeah, but if you think about it, prior to COVID, if you were looking for a care home, and I know we're focusing on care homes here, we do home care and live-in care as well, but if you just look at the care home side, pre-COVID, people would just drop in and have a look around.
Yeah.
During COVID, you couldn't
You
do
just
that.
couldn't do that, of course.
You needed all of that information online. So the way we approached it was you were opening your online windows and doors.
Which is so interesting, isn't it? Because the thing that really strikes me about the social care sector, comparatively to basically everything else, is that we're so sort of behind on that marketing branding piece, which I think you've done really well. You know, that kind of product placement, essentially. It seems anyway to me that you've kind of really curated where it sits, who it associates with, what it sponsors, and how it looks and feels. And I think that as a sector, we probably have got a lot of work to do on that.
I think we have. I think it's really interesting actually, because I've been having lots of conversations with providers over the last couple of months about how AI is changing that perception and how it's changing the way providers are marketing themselves. I think there's a combination of events that have happened that have made the competition so much more acute to attract the self-funding clients. And my expertise lies in the self-funding sector. We'll support any family. We don't distinguish at all, but we find that the self-funders tend to come to us. And so the way it's too wet, wants to go home. So I think we've got AI is just changing the way families are looking for care. It's changing their access to that information, and you've got this sort of multi-channel attribution. So, you know, families are just looking in so many different locations. And I say to providers, you need to recognise that. And I know we don't know yet with AI what is going to happen going forwards, but you need to recognise that breadth of search opportunity for the family and make sure all roads lead back to you.
And so what does that mean for a provider? What do they need to be doing?
Yeah, I mean, what does it mean? It means that you can't turn off an opportunity, a channel that is going to give prospective clients information about your service.
Yeah.
It's got to be visible online. It's got to have the right level of information that attracts them and engages them.
Yeah.
And no barriers.
Yeah. Yeah.
No barriers to them contacting you. You know, access to everything. It's
interesting,
big change.
isn't it? I mean,
big change.
We have really created businesses within the social care sector, many sectors, not just the social care sector, but certainly here, where we create a lot of friction to entry and you know, lots of barriers. And it's you know, barriers on price, barriers on information,
hidden
whatever
information.
that means.
No, out there. Open your online windows and doors. We estimate a self-funding family looking for a care home, 95% of that decision-making process takes place online. So
really?
And then the last bit is, of course, them visiting you and talking to you. I mean, that first phone call into you is absolutely crucial.
Yeah.
Absolutely crucial. But, you know, if the majority of their decision is taking place online, you have got to focus online.
Yeah.
And make sure you get your personal contact with them once they've come to you. Really look after that communication channel.
And what is the information that somebody is really interested in when they are looking for care for Auntie Margaret? You know, they're in that situation right there. What are they looking for? What needs to be satisfied? You know, at that point.
That's a really interesting question, because of course it's slightly different for everybody. But I would say the biggest issue when somebody is looking for care is they just don't know what to ask.
Yes.
What to look for. So we have an advice line, it runs 7 days a week. And so we're plugged into this all the time. And the main question that comes into us is, I think my uncle, my father, my mother needs a care home. And I live in Kent and they live in Surrey, so I need to find a care home in Surrey near them. And of course, so location is the sort of, I guess by default, location is the first thing you discuss with them. And you would carefully point out that, do they have very many friends in Surrey? Because you might want to consider the care home nearer you, so you can pop in for a cup of tea. I remember speaking to a family member who was doing a 3-hour round trip to go and visit her mum because she didn't know she could move her mum out the county, or it hadn't dawned on her.
It just wouldn't occur to you though, would it?
No.
I mean, actually,
get a care home down the road.
In many ways, you know, I'm called, or we're called as a business regularly from people that are looking for care, and you know, the agency model is such that you might have a dom care agency next door to where your parent lives, but the carer lives 3 miles down the road.
Yeah, that's a very good point.
You know, and in that same breath, you know, we'll have phone calls from people saying, well, oh no, we've called you because you're local. And it's like, well, the carer, you know. And actually it's so true. I think asking those pertinent questions and really thinking about location and where, you know, can I move somebody? And is it appropriate for that? Because
where's somebody going to visit them? Who's going to visit them, and where do they live?
Yeah. Because when we're looking at the quality of care, often it's all of the auxiliary stuff. And one of those items is who's going to come. And if you don't have friends or that social circle, maybe your social circle is also in care homes, you know, and so on. But it's such an interesting point.
It is. It's a really tricky one. And of course, you know, the other thing that people want to know is they want to know what the quality of the care is like.
Yeah.
You know, how good is that care home that's down the road from me? And of course, we've got some challenges with the CQC and the rate of inspections. And so I'm being polite, aren't I?
Point noted. Maybe I shouldn't laugh at it on a public
I think
forum.
that's the only thing you can do. But anyway, so by chance, about 3 years ago, no, probably longer ago than that now. So beginning of COVID, families on our advice line stopped asking us, where's the best care home near me? And they started asking us, where's the safest care home near me? Because they were worried about COVID. And I thought, I haven't got a flipping clue where the safest care home is.
And it's a moving target, quite frankly.
Well, exactly. So I spoke to a load of providers and I said, what IPC measures do you have in place to keep people safe? And they said, well, we do all of this anyway for the CQC. But of course, they've never actually promoted it directly to their prospective clients. But they've never had to. So we gave them the opportunity. We set up a little badge called SAFE. I can't remember what that stands for now, but there was a little thing for it.
COVID.
And it basically gave the providers the opportunity to demonstrate their IPC credentials. And then after that, we then thought, okay, so we've got IPC. What else really matters to a family when they're looking for a care home? Food. So we got Unilever involved, we got a whole load of stakeholders involved, and we set up another badge called Choice Dining, which meant families could find out the quality. He wants that ball. Find out the quality of the care, the type of the food, the type of food that was being offered. You know, if it was a nursing home, were they still getting a nice tray if they were eating in bed, and you know, nice cutlery and stuff, and the dementia side of it as well. So. Oh God, it was 6 months of really intense piece of work.
What a great piece of work,
Yeah, it was really good. And so we did Choice Dining, that was another badge. And then we actually went out to a load of families and said, when you're looking for a care home, out of these 10 things, what matters to you? And the environment came out top. We couldn't believe it. So we did another badge called Go Green, which gives care providers the opportunity to demonstrate what their green credentials are.
So a consumer is really looking at that?
Well, they
Apparently
tell us,
so,
I mean, we did about 3,000 people.
Unbelievable.
So
that wouldn't have occurred to me.
It didn't occur to me either.
All the ESG movement, whatever, but it just wouldn't occur to me that consumer is looking at that. But
No.
that is amazing.
Yeah, isn't it just? So we'd got these 3 or 4 badges, and I started to think, okay, how many more badges are there?
Yeah.
Well, my goodness me, I could identify about 20 without even thinking about it. So what we did was we thought, well, we can't have all of these different badges. We need to pull them all into one. So we developed OpenScore. And OpenScore is 65 data points. This is version 1. 65 data points, pulls it all in together, gives the care home a score out of 10, but it's a real-time update.
Fantastic.
And we're now very close to doing version 2, which will include mock inspections, because a lot of providers are paying for those.
Yeah.
And also the digital care planning software data points as well. So
which also, it's interesting, sorry to interrupt you there. I was on a call this morning with a chap from one of the universities in the Midlands, and he's doing a whole piece around bed blocking and hospitalisation.
My favourite topic, bed blocking.
You know, the conduit between hospitals and social care.
Yep.
And, you know, whether that be at home or in an institution of any sort. And it was really interesting, the synergies here. And I was saying one of the problems that we've got is that there's no singular data point, no data warehouse where we can spin, well, okay, I've got this much capacity at home, you're a nursing home, you've got this much capacity. How does that information go, you know, in a succinct way?
Yeah, we actually have a communication tool to, oh, lovely dogs, to facilitate that. We actually have built something for that.
Because I remember
we had
talking
that
to you about this. And so I wonder if you could tell me a little bit about that, because I think, I don't know how well publicised that is, and I wonder, you know, how many people are kind of really looking at that, and also how many people are looking at it from the hospital side, you know, so that we're actually able to...
Right, I shall hold on to myself here. What we want is we want a pilot in a hospital, and that's very, very difficult to get. We know we've got hundreds and hundreds of individual members of hospital discharge teams using our service to help them find appropriate care. But yeah, it is the most challenging thing. And of course, with the combination of NHSE and NHS, it's everybody's in flux. It's a very challenging area.
But there's just not one singular movement. And I think that, for me, as a provider and a kind of onlooker, that is a huge frustration from my perspective. I just sort of look at it and I think, well, how is this? How are we in 2026?
Can we not have this
joined up? We're
joined
starting the conversation with AI, but at the same time, I can't even talk to my local hospital and tell them, by the way, I've got 2 carers available down the road from you. Do you need that? You know, unbelievable, really.
There's no communication between health and social care. No.
And you know, and I was talking to a gentleman today, and I said to him, about 18 months ago or so, yes, you know, I hate the term bed blocking as well, but you know, there were very vulnerable people that are unable to get out of hospital and be discharged, and it was a huge problem in the hospital level. At the same time, there was a tremendous amount of capacity in the field.
Still is.
And
still is. 13,000 people sitting in hospital who they apparently can't get out.
You know,
give them to us. We can sort it out, can't we? Social care can sort it out.
And this is the thing that I was saying to them. I said, look, you know, this academic paper is wonderful, but actually the issue that we have is that we've got simple problems. A is not talking to B, you know.
Yeah, absolutely right. Absolutely right. One of the difficulties, I believe, is that you've got lots of social care providers bombarding the discharge teams, and they have no tool to manage that information.
Yeah.
We have the tool, but then when you're talking to the discharge teams, they like the way they currently work.
Yeah. And
I think that's the thing.
This is an issue, actually.
Change management,
and there is no change management because actually it doesn't serve anyone's purpose. It doesn't serve central government's purpose, and it doesn't serve local government's purpose either, actually. And it's very interesting because we were talking about, well, what is the driving force? Is it funding, budget? Is it quality? And I said, well, I'd love to think it's quality, but quality costs a lot of money. And actually, often we're in the race to the bottom when we're talking about local authority contracts and so on.
Yeah.
And so I can't actually hand on heart say that we're talking about quality.
No.
And that's where that
surely.
private pay market really comes in, I think, because actually if you've got a care worker, whether they be in a nursing home or in a domiciliary setting, to pay them properly, you need to charge a certain amount of money.
Yeah.
And if the local authority and central government are not issuing contracts of that description, then you are in a private pay market. But then it's a minefield. Because I started, in my book, I started one of the early chapters about this topic. And I basically said, look, it's an emergency purchase care. No one really thinks about it.
No, they really don't think about it. Yeah, you plan for everything else in your life, but not when you're going to need some support when you get older.
And it's really a terrible thing because we don't talk about it. We don't talk about the end chapter really, or the last chapters of that time. Whether we're talking about capacity, and so on. In fact, actually, I think in the UK we probably don't talk enough about money either. In fact, at that stage, and I was reading this book after listening to this chap on a podcast called The Automatic Millionaire, and it was all about really
nice.
and headlines are what it's all really about, kind of paying yourself first, and really kind of putting money away for that the later years in a really robust way, and that compound impact, which I think is supremely interesting. I've got young children. I think, if you did something like that now, and whether that's £50 a month, or whatever that might be, but when they are at that age, do they have a fund that they can plan for and say, well, this is how I want to live. I need to rehouse myself in this way. I need to think about aging in this way. I can have a personal trainer in my 70s, and so it's all of that, and thinking about that holistic approach of care.
We just thinks like that.
We don't talk about it, right?
No.
It's
we're going to live forever. We're not going to be ill. I'm not going to have a poor death. I'm not going to find that I'm immobile for the last 5 years of my life. No, we just don't accept it, do we?
It's a really interesting thing.
Is it just us? Is it just this country?
I think it's a lot in the UK. I think that our kind of very sort of stiff upper lip doesn't allow us to really talk about it. I remember I had a wonderful relationship with a chap from New Zealand who used to sort of head up a hospice in Oxfordshire.
Oh yeah.
And I said, well, we talk about it all the time in New Zealand. It's culturally, it is totally different. And I thought that was really intriguing. About how we just don't, even when we're going through it, we don't emotionally get into that whole piece. But I kind of look at what Autumna is doing, and there's a bit of that there. There's a bit of kind of the opportunity to talk about it.
Yeah, we're certainly trying. I mean, the girls on the advice line team, they're absolutely brilliant. I say girls. One of them's over 70. I mean, but that's life experience. That's real lived experience.
Well, that's who you want to talk to, actually.
Well, it is. I don't want to speak to a 20-year-old. I'm not being rude, but do I? All right, then I'll rephrase that. Do I want to speak to a 20-year-old who has no understanding, really, of the situation I find myself in? And that's not being rude. That's being honest.
No, I think life experience is a thing. I mean, I'm going on a slight segue here.
Segue away. In this weather, who cares?
I was with my personal trainer recently, and he is.
You're looking very well.
Why, thank you. Just a plug there, and thank you. I may need to get this suit taken in, but hey,
well done. You won't have to actually; it'll shrink because it's got wet.
And I'm talking to him, and he's in his early 20s, and he said, oh well, there was lots of sirens last night where he was living, and oh well, it's a shame. I had a really rough night as well, right? For whatever it was, I think it was some idiot doing fireworks or something, for no apparent reason. And he said, oh well, I'm just going to take a massive nap later. I was like, he's a lovely guy. I spend more time with him than I do with actually most people, frankly. And just looking at him. And he's like, "You should do that." And I was like, "Yes, I have 3 kids. I have multiple businesses. I've got franchisees that need support. I should take a nap on a Wednesday afternoon." That is.
It's a
yes.
different mentality, isn't it, to life?
Life experience, you know,
Yeah.
and he lives on his own. He doesn't have a
I don't
family,
think he does.
you know, and he takes a nap, you know, and it's. And
When did you last take a nap? I don't think I've ever taken a
probably
nap.
at uni.
That's because you didn't get up.
I didn't get up. Is it still a nap if you went to sleep at 7 a.m.? I don't know.
Yeah.
But, you know, and I think that is a really interesting piece around life experience of who you're speaking to. And actually, I think part of the training, you're talking about that first phone call.
Yeah.
One of the things I often talk about is how long is that first phone call? How quickly are we picking it up? You know, what are we getting into? Do we have a list of things that we could suggest that said person on the other end can go and do? So we do a lot of free community classes at Thrive Clubs. And so I think there's about 20 or so around the country at the moment. And, you know, whether yoga, Pilates, art classes, and, you know, but then also what is everyone else doing? And do we have a list of those things locally to say, "Hello, Mrs. Jones, here you go." You know, there's this free thing. Maybe you don't need care yet. Maybe you need this first. And then, you know, we can be...
That's lovely to be able to do that and to be confident to do that. I think the one... I have one example that I trot out that really had a big impact on me. I spoke to a family about why they chose a particular care home, why they'd chosen that one over that one, because online, on paper, in person, actually, there was very little distinguishing the two.
Yeah.
And she immediately came back to me and she said, "Oh, it was Sarah." I said, "Who's Sarah?" She said, "So lovely. When I first phoned, Sarah answered the phone." It's all down to Sarah and that first phone call. And the point being, that is how I want my mum to be looked after, how Sarah treated me. Now, Sarah almost certainly was not a carer. But that inference, that culture, that understanding is what that family wanted. And that's why they chose that care.
You know, but it's like shopping at Waitrose. You know, the product might be the same. But the fact is that it's the experience. You know, the person I'm asking, you know, where is the jam is going to take me to the jam. You know, it's telling you a little bit about my shopping habits.
It does a bit, doesn't it?
How many other jams do you have here? So, you know,
and where's the plum?
For goodness sakes, man.
No plum.
But
you're right.
The home care, nursing homes, and what, you know, and I sort of talk about this until I'm blue in the face. And it's the number of times that you will phone an organisation and the phone will just ring and ring and ring.
Tell me. Yeah.
And you just think that's an easy win.
Yeah.
Because guess what? No one's calling you back or leaving a voicemail. They're just going to carry on. It's a list of 10 people.
Absolutely. It's the next phone call. I totally agree with you. That is a very easy win. But of course, once you've picked up the phone, the really important bit is how you answer it, how you listen, how you actually understand what that person is inquiring about. I think that's really, really important. But the first bit is answer the phone.
Answer the phone. I remember when we were setting up Walfinch, and I did a mystery shop in a certain area, I can't remember where it was, and I literally called up 10 businesses. This is through the lockdown, actually.
Yeah.
Only 3 picked up the phone.
And you thought, I might have an opportunity here.
You know, and only one of them was a good phone call. I actually met the chap, you know, and so on. And you think, my goodness, you know.
How does that happen? And people still run a business.
It's unbelievable. And then we complain, you know, as a sector, you know, but actually there's some base level things. I think one of the things I love about what you do, if I can say, I just think that you are talking about the future. You know, it's not what we used to have, which was just block contract.
Yeah.
We then are moving into this kind of halfway house of people are doing a bit of both.
Yeah.
And now we're moving into that kind of Waitrose era of saying, no, this is exactly what we do. And yes, we do charge more.
Yeah.
But with
quality, transparency, trust.
Yeah.
I think in this AI world, this digital online world, I think the biggest thing that the biggest challenge providers will have you've got all the business stuff sorted out, is how do you present trust
Yes.
online?
Yeah.
And that's what we hope OpenScore feeds into. Well, we're being told by families that's what OpenScore is feeding into. So you've got an independent person, product that is demonstrating in real time that this provider can be trusted because this is the quality of their care. And as we add more and more data points into that, I think that will really enforce that message. But I do think, how do you get across trust? Because, you know, you put something on your website and you're marking your own homework.
Yes.
You're saying, I'm great.
Yeah.
You know, you want somebody else to say you're great.
Absolutely.
That's the thing, isn't it? But I do think that's going to be the challenge going forwards as we become more digital.
No, that's so true. So my last couple of questions for you, Debbie.
Yeah.
My penultimate question is, where is Autumna going? If I fast forward 10 years and you had a magic wand, what would it look like?
I think that's really hard to answer, primarily because of AI.
Yeah.
I mean, who could have predicted what the internet would have done in 5 years, let alone about 10? So I think that's difficult. Where do I want to see it going? I want to see that focus on quality and being able to evidence the quality, and that works for both provider and consumer. So everything I do with Autumna starts with, what does the family need to make an informed choice? Well, frankly, they need real-time data about what is happening in the care setting.
Yeah.
And that's what OpenScore feeds into. But on the other side of the coin, what does the provider need? The provider needs to demonstrate the quality of their care in real time. So that works for both sides. And if you've got a provider who is wanting to demonstrate the quality of their care via multiple data points, that's going to drive up the quality of care.
Yes.
And also, you know, you've got a care home that is providing brilliant care and brilliant everything else. That supports the argument for the cost.
Yeah. Yeah. And that's so
independently.
True. Absolutely.
Yeah.
Yeah. Wonderful. Thank you. And my last question for you is that we have a lot of carepreneurs that tune into this. So if you had one piece of advice to give them to say, well, this is what you would do to move your next bit of the needle, that next million in business, that first million in business, what would it be?
Trust your instinct. Try and think outside the box and trust your instinct. I think social care, we said this at the beginning, social care is a little bit behind the curve as far as most sectors are concerned. We need to be thinking what the opportunities are going forwards, but don't just look at it in monetary terms. I think if you can get it right in moral, transparent, trusted terms, then the money follows.
Yes, yeah. I think that's wonderful, actually. I think, what wonderful advice. Thank you very much. You know, just let the thing happen and do the right thing.
Do the right thing.
You know,
do the right
and
thing.
the money will follow. That is great. Thank you so much.
My pleasure.
A real pleasure.
Are you wet enough?
I'm always wet. In this wonderful Hampstead Heath.
I know. We've been going past some fabulous views, and I've been thinking, oh, blimey, this is great. Last time I saw this, I think it was 4 weddings and a funeral or something.
And I hope you enjoyed tuning in as much as I enjoyed filming. Until next time.